I'm a second-year resident at Freeman Health System in Joplin, Missouri. Today we will talk about beta blockers and sodium bicarb in cardiac arrest resuscitation, which is a little bit interesting, right? Okay. When should we use beta blockers in cardiac arrest resuscitation? This question is a little bit strange, right? Because in cardiac arrest resuscitation, we usually give epinephrine, which is a beta agonist. So you are telling me now we can give beta blocker? Really? Okay. So yeah, we can give beta blocker in cardiac arrest resuscitation in ventricular storm or electrical storm. What's the meaning of electrical storm? If you have a patient with 3 or more episodes of ventricular fibrillation or ventricular tachycardia, or the patient has ICD and the patient had 3 shocks from the ICD within 24 hours, so the patient meets the definition of electrical storm, and you can use beta blocker. We will see how now, okay? So of course, electrical storms can happen in patients usually with ICD devices, in patients with chronic conditions, chronic kidney disease, and of course those patients have high mortality compared to people who have only 1 episode of ventricular fibrillation. So what is the pathophysiology of electrical storm? So if you understand the pathophysiology, you can think, oh, really? It's okay to give beta blocker, okay, it's rational. So usually there would be a very strong adrenergic stimulation that triggers the electrical storm. And yeah, you can think if I give anti-adrenergic drug like beta blocker, it will be reasonable to stop the electrical storm, right? This is one of the articles that is published at the Journal of the American College of Cardiology about the use of propranolol or metoprolol in the treatment of electrical storm in patients with ICD devices. And they found propranolol is better than or superior to metoprolol in this case. I had a patient like that 1 week ago. The patient had ICD device and he told me I had more than 20 shocks from the ICD device, and the patient's EKG showed ventricular tachycardia. Do you know what I did? I just started the patient on imidazole drip and gave him a dose of propranolol. It looks a little bit strange to give beta blocker in ventricular tachycardia, but if you understand the pathophysiology, you will find it reasonable. So away from electrical storm, there is something that is a little bit similar to electrical storm, which is refractory ventricular fibrillation. What is the difference? Electrical storm, you have 3 separate episodes of ventricular tachycardia or fibrillation and rust after each episode. In refractory ventricular fibrillation, it's only 1 episode, but the patient is having ventricular fibrillation for more than 20 minutes or 40 minutes. And you are trying everything. You are giving epi, you are trying CPR, you are following ACLS protocol, you are giving imidazole, you are giving everything, and the patient is still having ventricular fibrillation. So this is the definition of refractory ventricular fibrillation, okay? So in this case, yeah, you may try osmolol or any type of beta blocker. This is another article. It's a systematic review and meta-analysis about the use of beta blockers in patients with refractory ventricular fibrillation. So let's talk about the guidelines. Okay. For refractory ventricular fibrillations, there is no official guidelines support the use of beta blockers in refractory ventricular fibrillation. But in electrical storm, yeah, according to the American Heart Association, you can use beta blockers in ventricular storm or electrical storm. According to the American College of Cardiology, yeah, you may use anti-adrenergic therapy or beta blockers in electrical storm. According to the European Society of Cardiology, you may use beta blockers in electrical storm. And of course, they like propranolol compared to metoprolol or other beta blockers. So this is one of my articles. I just published this article. I'm the first author there. I'm very proud of this article. It's about the use of beta blockers in critically ill patients in general. And we discussed the use of beta blocker in electrical storm and in heart failure and in a lot of other conditions, but one of them was electrical storm. If you want to read more about that, you can review this article. The second question is, when should we use sodium bicarb in cardiac arrest resuscitation? I think you can tell me, are you kidding me? We are using it all the time. Like, it's okay to use sodium bicarb, but really, according to ACLS protocol, we shouldn't use bicarb routinely during cardiac arrest resuscitation. According to ACLS protocol, we should, or American Heart Association, we should only use it in limited indications. If the patient has severe acidosis or hyperkalemia or tricyclic antidepressant toxicity. So if you don't have any of these indications, you shouldn't use sodium bicarb empirically or routinely. Just, give one dose of sodium bicarb or one push of sodium bicarb. According to the European Resuscitation Council, sodium bicarb is not recommended routinely during cardiac arrest resuscitation. Only in one condition, if you have prolonged resuscitation and the patient has effective ventilation. Why? Because when you give sodium bicarb, the bicarb will be converted by carbonic anhydrase to water and CO2. So if you don't have effective ventilation, the CO2 will accumulate in the blood and the patient will have paradoxical respiratory acidosis, okay? This is very interesting really, because most of the articles that suggest against the use of sodium bicarb, they just study the use of sodium bicarb in cardiac arrest resuscitation, any type of cardiac arrest resuscitation. But in this article, they focused on a subgroup of patients who have cardiac arrest, only patients who had E-systole or PEA. And they found it's beneficial. It's not part of the guidelines yet, but we need more clinical trials to see if sodium bicarb can be beneficial in some subgroups. This is one of my articles too. I'm the first author there. We published this article at the Journal of Clinical Medicine. It discusses the use of sodium bicarb in critically ill patients. We summarized everything. We summarized all of the recent guidelines, clinical trials, retrospective studies that discuss the use of sodium bicarb in DKA, rhabdomyolysis, hyperkalemia, AKI, cardiac arrest resuscitation, and more. And we found, as I mentioned, like most of the guidelines suggest against the use of sodium bicarb in cardiac arrest resuscitation, except if the patient has hyperkalemia or tricyclic antidepressant toxicity or severe acidosis. I really invite all of you to read this article. It's very interesting. Thank you so much. This is my email if anyone wants to reach out to me. Do you have any questions?
Next up from